Hello, my name is Roy Poyan, and I am the Director of Families Impacted by Opioids. Welcome to our next episode, Fentanyl and Families in Harm's Way. Today we're going to look at treatment centers, and in the treatment center we're looking to kind of bracket the care of our loved one who is misusing substances and has a substance use disorder. You may be approaching this treatment center without a diagnosis, or you may be approaching them with a diagnosis from earlier and you're not sure about the staging. You also want to confirm the care plan, that the plan of care matches the staging, which matches the diagnoses. So what would benefit the family the most is if you took the time to introduce yourself, and you don't necessarily have to bring this person with you, but that the family members have an understanding of what the treatment center does, what they do not do, what they require for admissions in terms of paperwork and payment, and get all these things kind of organized. You could even start a folder on it. Maybe you shop around and see, are there several IOPs in the area, residentials, detox centers? Does one have the dual diagnosis capacity, meaning they have some type of dialectic therapy, or then combined with mental health treatment for dual diagnoses? Are they able to do cognitive behavioral therapy and treat their depression, in the same episode of being admitted at their facility? So there's really a sundry of questions that you need to know, as well as what's the quality of care? Are they using best practices? What's their patient to staff ratio, and how does that compare to the average in the area? What do they charge? What are you paying for? What are you paying out of pocket? You can get all these questions answered ahead of time, and you should, and then record them, and do that for maybe 1, 2, 3 if you have a choice of 3, because you may use this one this time, and then when they relapse, it may be that you're not inclined to go back to the one that you used before for whatever reasons. It would be nice for you to have already done the homework and looked at 2 others if they are available in your area. So now what we're looking at is the treatment center is saying to you all, depends on what condition he's in when he arrives, and here's our criteria for admissions, and more than likely, preferably they do a detox and then they move them into some type of IOP, longer range treatment, and now their real therapy begins with treatment. And then it may be that they start to introduce medical assisted therapy while they're in this treatment, which would be very good. And then you want to know about an aftercare program where it's almost a step down in intensity from the IOP, and now you're moving into them returning to their regular life without these supports, meaning aftercare. And then now they're looking at support groups, sober living, their living environment, aids for daily living, and their Maslow hierarchy of needs starts to become a managed environment outside of this acute care setting. What they're not going to do is fix your loved one. They'll show you how, and they'll show them how they are to manage it. They can show you how, a little bit about how you can co-mingle with that management. It would be very good if you attend all of their family sessions so that they have the advantage of helping you understand what they will be like when they're released from their treatment. Now, what we want to make sure is that you have an understanding of when discharge is coming up. Shouldn't be a surprise. You also have to be careful with against medical advice. They're likely going to call you and say, "Oh, terrible things are happening. This is terrible for me. You need to get me out of here." Confirm that that is or isn't the case, but don't be so inclined to say, "We'll come down and we'll get you because you feel this way." It's of course they're going to feel this way. They don't want to have to go through this. It's very important that they complete their treatment plan. If this is a quality environment, it is going to be rough for them. We can't help them to avoid that. But just know that if it's a quality location, they're doing all that they can do on their side. Excuse me. So what we're going to do now is we're going to look at exactly how the family is ready for this person to go in, and then during that time frame, that's the time for you to get ready for their re-entry. How is their life going to be different? If some illegal activity took place, do you have to deal with that afterwards? Are they on probation? Are they involved in drug court? What commitments do they have to reimburse something that might have happened while they were, in the state of active using? Now is the time for you to do all this and get ready for their reentry. And it's also the time for you to make changes. So you should be in therapy while they're in treatment. And then that way the two of you are making changes for a more conducive environment going forward. You'll have a better understanding of what your role is. These seminars that we're providing with you, they're just the beginning. And in no way are they ever intended for you to say, well, we've taken the Family Solution Finder Learning Series, so we're ready. And the answer is no, you're not. You're not even close to ready. All we did was introduce 32 topics that you need to dive a lot deeper in and get ready for because of the likelihood that they will occur in your life. So let's take a closer look and come on to the family table. We'll break it down and we'll see where your family is in relation to the treatment centers in your community and what you can set up for kind of like a preparation. Because if your loved one is going through substance use disorders, you're almost assured you're going to have to use one of these treatment centers. Don't wait until then to figure out who they are, what they require, how they do what they do, and what your role is. While your head is a little bit clearer, take the time to do that now. And while they're in treatment, that's not a time of respite for you. You need to be as active as they are in making changes so that you're both in line when they get out. I can't stress that enough. It's so important. So many times we see the family drop the person off. They're so angry at them that all they really want to do is to see that they get better and that they return to them better. That's not going to happen. They're going to come back to you, and it's going to be the beginning of a very hard journey of abstinence and sobriety. Their mind will be screaming at them to change the course and go back to using. And the environment that they come back into, which you do have a role in terms of setting this up and helping with, is going to be critical to the success of their lifelong recovery. So come on, let's get over to the family table and start learning what it is that you need to know about treatment centers.
Hello everyone, thank you for joining us at the family table. We have an interesting topic to talk about because most people, when they think of addiction, immediately think of a treatment center. You can see from these presentations that that's not necessarily the sequence. We've involved the police, we've involved overdosing with a medical intervention, we've involved the courts, and now we're at the treatment center. It doesn't necessarily have to go in that type of sequence, but often we find that it does, or it may, for a certain set of our population that's dealing with this substance use disorder. And what we want to do at this point is suggest to you that you could do 90% of your homework now before the treatment center is needed, and you'll be glad you did. Number one, it's nice to have choices because it may be that for one condition, this particular treatment center is excellent. For another one, this is preferred. It may be that there's an out-of-state one that is just what you need. It may be that the one that's local will do just fine for this particular relapse. Unfortunately, I'm saying this particular relapse. It doesn't necessarily have to mean that a next relapse is imminent, but it is possible. And in many ways, it's probable, especially if you're on your first relapse. The fact is, when a person has first tried the drug, their overdose or admission into treatment is their first relapse. So it's very possible that trying the things that are learned, the behaviors that they're trying to practice in terms of long-term successful recovery, battling off triggers that are kind of like impeding on their ability to function cognitively in their thought life are such great challenges for them that the relapse will happen. Now, we do have a separate episode for that, and I encourage you to view that, called The Relapse, and we'll get into the stages there. But what's important for us to know is what exactly is done in a treatment center? A lot of times we say to somebody, well, how's Jack doing? And somebody might say, well, he's in rehab right now. And they think, okay, that's fine. Well, oddly enough, they were pretty satisfied with that as the answer, and maybe they should be. But the fact is, as the family member, we need to know more than he's just in rehab. We need an understanding of what exactly is he receiving for his plan of treatment while he's in rehab. Remember, we talked about plan of treatment in the way that we talked about a diagnosis and then a staging and then a plan of treatment. That same applies. That's what's happening here. This person has a diagnosis, they have a staging, and now they're being applied a treatment, which is a recovery rehabilitation of his current condition so that he can more correctly function in life going forward after discharge. Now, we need to look at this more as an episodic care plan, meaning it's not chronic. And I'd like to kind of like visually for you create a timeline. And in that timeline, I'd like you to paint the first part of it for 16 weeks orange. And let's call that the acute care setting, meaning he's at a facility, a program. It could be a residential, it could be a partial hospitalization, it could be an intensive outpatient program, it could be an aftercare program. But it has a finite point of when it's going to end, okay? So that's considered an acute care, meaning it's episodic. It's based on what happened, it's an episode. Now, the more important and what I would like to see us paying more attention to as a community and as an industry, I'd like to see more of our focus be on the chronic services. And that's really where a lot of the more, you might call heavy lifting is done. So what we're doing in the episodic treatment center is to not fix them, they will never be fixed, is to help them understand from detoxification forward what exactly it is that's taking place for them in their life. So they will be introduced to the idea of dopamine and how dopamine it stimulates our ability to act. It uses the reward system and the memory system to determine what level and where it's going to be sending its dopamine as an electronic pulse and then chemically across the synapse to the receptor sites as it reaches the break and then continue on as a neuronal firing. Now, what we've also helped this person to identify is that these wires have been rewired based towards a heavy-weighted listening to reward and pleasure. And it's overriding judgment, logic, and reasoning, which is in the prefrontal cortex. You're sitting there saying, Roy, I thought we were talking about treatment centers. You're talking about the brain. Yeah, they're both aligned, okay? So what's being done in the treatment center is to help in that elasticity so that the brain can start to recognize that more weighted, credence should be given to logic, reasoning, and judgment. Slow down your life, Jack, so that you can pay more attention to that, because that has more positive outcomes for you than what your memory and your reward system are telling you is what you want. You don't want to listen to pleasure. You want to listen to judgment and reasoning and logic. So that's called cognitive thinking. Cognitive is like another word for it might be awareness thinking. So now you're talking about basically we're working with this person in the treatment center on a particular program model that's either identified as residential because they qualified and that's the level of care that they need, meaning that they're at the location, living at the location for a period of time, or partial residential, which means that they'll come in and they may spend a longer period of time at that facility, or an intensive outpatient, which means that they're coming in, meaning they're living at home or what they consider home, and they're coming in for a certain number of hours, a certain number of days each week. And so that in that intensive outpatient known as an IOP, that IOP allows them to function in their life, have a job, go to school, but it's a cumbrance on their time. They've got to, this is the most important thing, and these other things they can kind of create outside of it. But obviously, this is the priority, because without this getting right, meaning the IOP and the work that's being done there, the rest of these things won't be able to really function well in their lives. So with that in mind, it's a real struggle in that period of time, because they're trying to go to work, they got to go to their IOP. Let's say they got a dental appointment because they've been taking, the different stimulances, and now we've got this whole kinds of other types of characteristics of medical and social and time at church, and boy, it really becomes a challenge. The priority is the treatment center. When they are dealing with an episodic level of care, it's episodic. It has an endpoint. And that timeline is going to run itself out regardless of how well they do or don't do. In other words, the payer is not going to continue to pay after, say, 16 weeks is up. I'm not saying that's your number, but if that is the case, that's the finite part of it. And then they get discharged. Well, let's talk a little bit about inside the area of the treatment center, and we do that by helping you to understand it with your study guide. And we'll turn to the treatment center section of the study guide, and we'll start to introduce ourselves to what is the acute care and how does acute care work with a disease, which is chronic care, meaning it's afterwards. So in that timeline where it was orange, now take the rest of that timeline for 5 years and paint it yellow. And that color of yellow is 5 years. If they can get to the 5-year point with abstinence and sobriety, then they drop to less than 15% likelihood of relapse. So that's not an end point, it's a milestone because their life continues on. But it certainly is a significant milestone. So our level of treatment and care is absent in that timeline. Unfortunately, we are not set up in our society to treat this disease, even though we are categorically in the DSM-5 calling it a chronic disease. We do not have a payer system and services that continue with what we call the continuum. And inside the continuum, this timeline of up to 5 years, we should be providing a plan of treatment, levels of care, revisiting assessments, because it's there that the person has a difficult time, especially in the beginning of those 5 years, the first 18 to 24 months, of being able to really grasp hold of their sobriety and abstinence. And that's when relapses, the second relapse, will often take place. What we want to do is we want to make sure that the family understands they're a part of the whole timeline. They're the only ones that are a part of the whole timeline if they're engaged in this person's life. Well, I mean, when you think about it, we told you that the ER visit stopped after a certain level of care is needed. The same true for the hospital visit. The treatment center, same thing. After a certain number of weeks, it ends. And so we're kind of like moving ourselves from this service to this service to this service. Let's introduce another word, and we'll call it continuity. So what is the continuity, meaning the transfer of their care, their treatment plan, as they move from the hospital to jail, or from the hospital to a treatment center, or into drug court to a treatment center? So now we really need to take a look at, there's a lot of things happening to this person, but we want to stay micro-focused on the diagnosis, the staging, the plan of care, and the progression. If we're focused on just that as our primary issue of interest, we will be available to do all the other things that are needed to support the continuity of care in the continuum of their plan of treatment. I'm introducing a lot of new terms, I realize that. But if you have these as part of your vocabulary, you're going to understand more clearly what it is that's happening and be able to communicate your understanding with other people who are of the like understanding, like your clinicians and your doctors. Because when you sit there and you say, what assessment tool are we using while they're in the treatment plan, while they're in the treatment center, to determine how they're progressing? What assessment tool? Are you using a DAST? Are you using an audit? Are you using, what type of results are you seeing that would convince us that that Bob or Jane are moving forward in their progression of their treatment. And that would tell us if we're giving the right level of treatment. Remember, the plan of treatment produces an outcome. If the outcome is not being measured and reported and recorded and reported then to the people who can make adjustments and tweaking it, then we've got a deficiency. It's really hard for you outside of a treatment center to know if they're doing all that. So a very loosely used term, and I don't mean this to sound critical, but some people have fidelity to a program and some people kind of modify it a little, depending on their needs. So they might make the statement, we use empirically proven studies and empirically proven programs as our best practice with our treatment center. And they probably do. And they probably do it very effectively. But the outcome is really what should be looked at. And I'm not quite sure we do a very good job of that, because when you think about it, after they get discharged from a treatment center, who's available to look at the outcome? And so we start to look at, well, they didn't relapse. Well, I don't think that relapse is a good indicator of an outcome. What about their quality of life? What about their aids for daily living? How well are they functioning socially? There's a lot of characteristics that we need to be looking at, and not using outcome or not using relapse or overdose as being the indicator. It's almost like saying, well, that's too late, and it would be. Are there ways that we can be looking at progressing positively or not progressing positively in their treatment plan? And that's what a treatment center is all about. They set up in this person's life knowledge that they can use. Now the problem is, you're not in the room. That's not a problem, but it is the situation. And I'm not sure that you should be. Matter of fact, you probably shouldn't be. But the fact is, you should be doing your own education. They're getting smart and they're changing. And if you're not, then you're not. Okay? It's that simple. So as they start to learn how to conduct their thought life in cognitive behavioral therapy or dialectic behavioral therapy, they have lots of different concepts of doing this process of helping to reorient the person's way of living their life, managing triggers, managing exactly how they will communicate with others, who they'll communicate, why. They're just raising their awarenesses up, their cognitive awareness up. And you're not, or you are. Well, you certainly are, because you're taking these episodes. And hopefully, from our suggestion, you're not stopping here. This is just the beginning of your learning. So you want to Google treatment centers. You want to Google best practice in treatment centers. You want to Google outcomes. You want to Google questions that a family should be asking inside the treatment center. So what we start to look at is, like we've done before with the courts and other people, other organizations, how are they structured? Well, there's typically a physician. That physician is typically an MD, or it could be a DO, and they are an addiction treatment specialist. Then we also typically find a licensed psychologist, PhD or academic PsyD, and then their specialty is in addiction treatment. Then we typically have licensed clinical nurse practitioners or social worker LSWs. You'll see that used around. LMFT, a licensed mental health family therapist, and also licensed certified addiction counselors. There's also mental health coaches are being introduced to the process. So with this in mind, we're starting to see the structure of where our loved one is going into, and what are the certification and qualifications of the people that are going to be dealing with them. So they're looking at, you want to find out that there's not one single way that they handle everybody. And that's a question you could ask. How many different ways do you approach, or do you have available to approach, and how do you determine which is right for our loved one? How quickly can we get into the treatment center? How effective is your treatment for all patients needed, not just for the one that use drugs? So, have you involved other types of, do they handle gambling? Do they handle alcohol? Do they handle drug? All of these different types, sex addictions, or are they just focused on one? Do they offer, what types of counseling do they offer? Do they offer multidimensional family counseling? Do they offer any kind of Bowen family therapy? You'll learn that in the family therapy section, which is in a previous episode. Medications, what type of medications are most commonly prescribed? You of course will not see them using an awful lot of pain medications, but they will possibly use some type of symptom relief especially during detox. But when we talk about medications, there's another concept that we want to also mention. In the acute care setting, in the treatment center, is a great time for them to start buprenorphine, and what that is, it's called medical assisted treatment, or Suboxone. And these are called medical assisted treatment because they assist the patient in suppressing the cravings. You see, if your mind is raging, and it is typically when they're in treatment centers because it's so new and they're just come off of the drug and the drug is still screaming at them to come back to them and give them pleasure, and they're not going to produce dopamine, so now they don't have an awful lot of dopamine that's naturally being produced, and they don't have the substitute coming into their body with the heroin and the other stimulants. So they're kind of void of what would normally have been regular dopamine, helping to control our neuronal firing. So with that in absence, their body is just screaming at them. And so now that's a hard time to learn. And at this point, we're trying to teach them cognitive behavioral therapy as triggers and things like that. Well, in the first 2 or 3 weeks of learning, they may not for their own fault, be able to absorb and retain a lot of what's being taught. So by you also understanding some of these things, when they get out of this treatment center, you can be a conduit to helping them by showing them that you do understand these other thoughts and ways that triggers are managed, and because of that, you can be an ally and assistance in creating the right environment for them. You know, I'm not talking about, when I talk about triggers, empty the house of all the alcohol. Well, yeah, of course you should do that. Those aren't the kind of triggers. Other types of triggers are enabling, boundary setting, other things that we've discussed about that you do have control over. When you're having the holiday, you know, you don't want everybody to sit there and say, okay, walk on eggshells around them. You might want to say, you know, be available for a discussion with him, understand that he has, you know, a lot going on in his life, but treat him normally. In a lot of cases, this person's just looking to be loved. You know, they're in treatment, they're doing what they're supposed to be doing, and in many ways, and we just do this, and you know, it's not necessarily we're bad for doing it this way, but we tend to like say, well, he hasn't tried hard enough. I mean, he's still in treatment. Well, trust us when we say treatment's a lot of work, and there's a lot of changes at a time that his mind is not really all, you know, processing correctly. So that becomes a challenge too. Trust me, you don't want to be there. But the fact that the person that is there, we need to be empathetic to them. And we need to, you know, they're in the treatment center. So when they are in the treatment center, we need to be understanding. We still need to do our work. We need to take a look at ourselves and see how well are we functioning? What's our potentiality? And, you know, are we playing a certain role that's not, you know, not helping things? Are taking these course materials seriously and really applying to them and using the determine a solution, develop a decision, and design a plan of action as our process assures us that we'll use the information that's learned in our lives more effectively as it relates to them being in the treatment center. So how do you know, what level, a hospitalization, a residential, non-hospital, inpatient hospital, outpatient intensive care, methadone treatment, Suboxone, Vivitrol, all of these different types of medical assisted therapies that are available. This is a lot to do. So you learning on your own is good. Getting a family counselor is better. Getting a drug coach that handles addiction as a specialty in terms of families would be excellent. And there is a growing body of people who are getting certified in peer family services. As those grow, if they're available to you in your community, take advantage of them. They can give you fabulous insights. So yours is one of seeking knowledge that helps you to be more able to conduct yourself in this new environment of you are a family, and your family dynamic will now and will always include substance use disorder, because it's a chronic brain disease and it's not going away, and either is this person. You are now going to conduct yourselves with that as your new reality. And so with that in mind, the more you know about the treatment center work, the better off you can be when they get out of it and they go on in their lives as they progress towards that 5-year marker that we talked about. So what happens when they relapse? Well, typically they start all over, but not necessarily. A good program will not sit there and say, okay, we're going to redo everything because you obviously didn't get it before. A good program could take a look and say, in what areas did this fail? A relapse isn't a failure. It's something didn't get adjusted and it became such a stress point that it broke. So he might have been doing characteristically good with work, social, and some of these other things. But nutrition and taking care of himself, he wasn't. So he gradually grew to mentally romancing the idea of maybe it wasn't so bad, and going through the 3 stages of what happens before a relapse, and then going to the physical stage of, I drove by the other day where I used to use, and I was able to do it and not stop, but the 3rd time he did it, he did stop. Okay, bam, the relapse. So what happened there? Well, something, in before that happened could have been adjusted so that that particular part of the progression towards a relapse was thwarted and didn't occur, and changed and strengthened. So really what we're talking about in a relapse and back to a treatment center is we want to strengthen those areas that he was weak in and reinforce those areas that he was strong in. So you might sit there and say, well, how come in the first relapse, he relapsed, say 6 months after, but in the second relapse, he didn't relapse for 3 years? Well, that's probably why, because his knowledge base or her knowledge base is building from his treatment center. Treatment centers provide kind of like a college on the idea of what they're going to do in their life. But just like college, it has a learning point, it has an ending point, but the learning continues on their part. And then the environment, like a good job, will use what he's got his skills in the environment that he's living in. That then hopefully takes advantage of the things that he's strong in or she's strong in, and is able to then function in the community in the same way that we would if we didn't have this as a condition. So the fact is, where's the family in all this? Well, you take this learning lesson and you then apply it to yourselves and the practical exercises. And now you start to sit and say, well, how is it determined what level, like hospitalization or inpatient? Well, there's addiction substance abuse medicine. It's called ASAM. They commonly refer to it as ASAM. And it's a society of an association of collective intellect that's used for setting the direction of a plan of care. And it has a certain way of saying if, then, go to, and it builds based on certain characteristics exactly what level is the right level. I didn't want you to feel that somebody is sitting there saying with all-knowing wisdom down in a treatment center, oh, he should be in hospitalization. It doesn't work that way, or it shouldn't work that way. They should be using and I'm sure they are, the ASAM model for quantifiably identifying what level is the right level for this person. Now, the ASAM can be used as a reassessment. And once you've gone through the initial assessment, everything they're following is a reassessment. So it's a reassessment as to what stage is he in. Did he progress in his mental health in terms of his severe anxiety? Is he now from a moderate, has he moved back to a mild? The same is true. ASAM would then be used if somebody was thinking he needs to go back into a treatment center. Well, justify that. well, the way that they justify that is through the diagnostic, the staging, and then the plan of care on the staging, and ASAM to determine what level. So now you know a little bit more about that, but you need to also know more about the payer system, because you're going to have to pay for this. And you either have a managed care, possibly a Medicaid HMO that has this built into their plan, in which case you're going to need to go to one of their in-network providers. In some cases, it'll be suggested, and it's up to you to review, that you'll be going to a location outside of your area. That I wouldn't necessarily say that that's a bad idea, because what we often find is that some of these other areas have consolidated their financials, their operations, their centers of excellence to a specific geographic area, and that one center does a lot of really good like mind mapping and other types of much deeper dive that would be a benefit to you. Now the question is, well, is the best benefit? You don't know if there's going to be 3 relapses. You only know that in review, and you might sit there and say, gee, if I knew that he was going to go through this 2 more times, we probably wouldn't have sent them to Arizona, and we live in Ohio. We probably would have done something more local. Well, none of us have that as an option. So you just take the condition as it's presenting, take the history, and take what are the possibilities that can be paid for, and what some of the financial venues are for you to take advantage of, and then make the best decision at the time. And later on, when you're looking back, you'll always be looking back with a certain cognitive dissonance of, did we make the right decision or not? But I think that what is most important is that in your decision making, as you develop your decision, you take into account primary sourcing information, meaning if you have the chance to go to the facility beforehand, go there. Okay, go down there and let them know, I've got a child who's, is addicted to opioids, and I know we're going to need you in the future. Can you give me a little bit better understanding about what you do? We're shopping around to see what programs offer unique, types of mapping out their plan of care, and what might be best suited when this situation happens, that he can get to a treatment center and start his recovery. So with that in mind, you're taking the step to walk into there ahead of time. And communicating with them, feet on the ground, is really important. Now, let's just take a quick moment and talk about what happens while they're there. They're, especially in detox, they're going to tell you they don't like it. They're going to tell you they're being mistreated. They're going to tell you that you don't love them and you made them go through this. And all the pain that they're experiencing is your fault, not theirs. And you know that that's not the case. So with that in mind, after they do that enough and enough and enough, finally, you may be inclined to sit there and say, fine, we're going to come down and we're going to pick you up. That's called Against Medical Advice, AMA. And we strongly, strongly, strongly encourage you, don't do that. Unless there's a really blatant, obvious reason to you feel that they are not being in good care, meaning like it's really bad, then, and you can verify that, don't do it. They have to go through the pain, which means they're going to share that experience with you. That means you have to go through the pain if you're going to be in their life. And therefore, you know that you can change that. Do not do that. Let them go through this process. It's the only way that they're going to get to the other side. And even if you do that, you're just going to have to restart all over again. So you're not even delaying it. You're interfering with it in that case. So what we want to do is we want to make sure that we take a look at some of the videos that are recommended in the workbook so that you can get a better understanding of what the industry is letting us all know about how they handle treatments in a treatment center. And with that in mind, we do encourage you to take the time and determine a solution, develop a decision, and design a plan of action around learning more around the issues that you have in learning more about treatment centers. Because in the end, you're going to need to make a record of, and this would be done in your local resource connections in your workbook, so that you can then have these names already in your kind of like your repertoire of when this comes to the place that we're using a treatment center, and you will experience this. If somebody is going through addiction of any type, they're going to have to go through a treatment center, which probably means they're going to have to do a detox, a draining off of the substances that they had in their body, which is, for drugs, very painful. It's described as something similar to having all the bones broken in your body. And for alcohol, it could be life-threatening. So not so much with drug detox, but with alcohol is what's noted. So what we need to do is we need to take this process with a forethought, get educated about it. When it's happening, ask good questions. In the book, we give you questions to be asking, but come up with your own also. Go in there, do primary in your decision-making, do a primary source, meaning go down there. Don't take it for granted that Jerry's wife says that Bob went through this and this group was great, use them. Don't take that. You go down and see this group. The same is true for, don't look at the internet, think, oh, this is great, it looks all good. You know, anybody can put anything on an internet with pictures. You go down and visit this group, ask questions. What is the patient to staff ratio? What empirically proven studies do you use? How do you train new employees so that they're up to speed with, and how are they supervised? How are new employees supervised? And what's your turnover rate? You know, there's a lot of things that you want to ask from the treatment center so you have an idea, and then compare like 3 or 4 of them in your area so that you have a good idea as to what's available. I want to thank you very much for taking the time to view this episode of Treatment Center Intervention. It's an intervention that you will experience, and it's one that you can participate in. It's a time when everybody, both you and them, grow. Hello, I want to thank you for continuing to view our episode. And we're now going to work into the area of the 3 Ds. This is an important characteristic for the family to develop skills in. And we'll start by taking the time to look at an issue and then determine the issues based on the area of determining a solution, developing a decision, and designing a plan of action. By using your Module 3 workbook and going to a specific issue, you'll be able to find that the first step in that 3D skill set is the FTR, the Family Transformational Model. And the Family Transformational Model is a set-up way, each time the same way, that we will take 5 categories to look at in determining a solution. And each category is going to have 3 questions. So let's get started. The first is to define the issue. Naturally, we'll want to know what the issue is. The word issue is really problem, but we're saying the word issue is, the reason we're saying the word issue is it's just a little bit easier to digest, because it's not always a problem. Sometimes it's just something that's happening, and we need to determine a solution to it. The next question is, how does the issue impact the family? We need to know that. We need to know, we have an issue, that's fine. The issues can exist, but if it's impacting the family, in what way is it impacting the family? And then what steps can the family take to prepare and then respond to the issue? That's very important for us to know. The fact is that this issue exists and it's impacting the family. We tend to believe maybe there was something we could have done to kind of get ready for it. And if there was, then we would want to have taken those steps, which is what all these episodes are about. And then who can help assist us and the family in our response? So we want to start to ask ourselves, we know that there's an issue, we know that it's impacting the family, and there are things that we could do to prepare for this, but we're probably going to need a resource, information, another person outside of our family, or maybe one of our family members specifically can use their functionality and contribute. So we want to identify that. And then what should the family expect as their outcome? And kind of a start with the end in mind thought, where we're saying, if we're going to do something, it's going to result in something. So is that result desirable? Is that really what we want? Because if we're going to create a solution, then we want the solution's outcome to be what we expect it would be. So in each of these categories that I just described, 1 through 5, there are 3 questions, and we're going to ask ourselves each of these. Let's go back into the first category, define the issue. Clearly state what happened or what will happen. We want to know very clearly what happened or what's likely to happen. And then write that down. Identify who's involved or who should be involved. And then what would you like to have happen or like to see happen? The third question in every category is going to be used. You'll see how in just a minute. But just remember, the third question in every category, so this question right here, the way you answer it, will be reused. Now the next question is, how is the issue impacting the family? Who in the family exactly is impacted? In what way are they impacted? And then the third question is, what is needed to move forward? And then the third category is, what steps can the family take to prepare and then respond to the issue? The 3 questions again. What needs to be done? And then prioritize that list. Who needs to be involved? And then what will it look like, the third question, what will it look like when completed? Then the 4th category is, who can help and assist the family in their response? The 3 questions are, how to search and organize this organization to help you. In other words, it's not enough that you know you're going to go and introduce yourselves to a treatment center in your community. You want to start to determine, how do I look for them and organize my way of seeking help, because it might not just be that group alone. You may also need other services to kind of start to create a who can assist us. And it may be many different types of people. What to ask from them, and then what to expect. Remember the third question, what to expect. And then the 5th category is, what should the family expect as their outcome? Well, that has to do a lot with timing. And if it takes a certain amount of time, let's be realistic of what that is. That has something to do with the expense of the involvement, of getting involved in this issue. And then the third question being, required changes, our changes as family members, for this response to successfully take place. Now, let's state what our solution is. Hey, this is the great news. You've already developed your solution. By answering each of these 3 questions, the third question in every category, you'll pull forward now into your statement. So your first sentence of your statement is the third answer in the first category. What would you like to have happen or like to see happen? Well, that becomes your first sentence. So what your first sentence for your solution statement is, what we would like to see happen is, and you just pull your answer from there to here. Do the same thing with the second category. How does the issue impact the family? Using the third question's answer, what is needed for the family to move forward? So now your second sentence is, what's needed to move forward is. And now you're accumulating these answers from these categories, the third question, and it's actually becoming your first sentence, your second sentence, your third sentence, your fourth sentence, and your fifth sentence in your solution statement. So your solution statement is going to sound something like, what we would like to see happen is, and what's needed to move forward will be, and then the third question from the third category, what it will look like when completed will be, and then what we expect will be, and then what's required for us to have a successful response is. Now those are your 5 sentences. You've just constructed your solution. And this is how you go about using a model for creating a solution. For any issue in life you have to face, you can use this as a way of approaching it. Now let's go to the other area, which is the second coping skill, making a decision. Let's make a value-based decision. Let's make a decision each time that kind of balances with what we value most. So first we want to determine what are our values. Well, the best way to do that is to write down on a piece of paper, what types of things do you as an individual value most? And each member of your family can do this in a kind of a group exercise. And then once you've done that, I value love, I value honesty, I value relationships and sharing. These could all be an individual's 1, 2, 3. Then prioritize them. Which of the 1, 2, 3 is most important? Then have each member of the family do the same thing. And then you can sit there and say to the family, what was your number 1? What was your number 2? What was your number 1? What was your number 1? What was your number 1? And then what was your 2? What was your 2? What was your 3? What was your 3? And where you start to see many people in the family say, well, my number 1 is relationships, my number 2 was trust, and my number 3 was love. Well, then you talk to another person, they say, well, my number 1 was love, my number 2 was personal expression or confidentiality, or so they mentioned something different, but they did mention love. And then the third member of the family happens to mention love also. You know now that love is a value of the family. So whatever decisions you make, you want to balance it on the fact of, does this disrupt our values? If it does, at least you know that it does, and to what degree. You're calculating that. But at least also you're including, what do we value most? Let's make sure our decisions don't counter that. And now, in the first step, we're going to identify exactly what's happened. And this is, by the way, in your book, okay? And it is for each of the episodes. Now, identify exactly what's happened, what happened, how did it happen, who did it happen to. Then the second step is analyze the situation, assess the problem, identify the problem, and in what areas did the problem create an impact. You're writing all of these down. The third step of that the third step in the decision-making model is, what is the number of one contributing factor? What is causing this issue to take place? You need to know that before you make a decision. The fourth step is, now that you know the number one factor, you need to go out and find out what information there is about this. Your primary source, you're going to go to the actual person or organization that's involved with this and ask them, what is this issue, and help us to understand it better. The secondary source would be, somebody's telling you this happened, or somebody suggests that you should do something a certain way, and it's coming from somebody else other than the primary source. It could be an article, a clinical paper. These are all secondary sources, and you gather them and you make them part of your primary, secondary information gathering. The third area that you look at is your gut. What does your gut, because that's often where our faith comes in, and other things that are very important when making decisions get included. So trust your gut is what we're saying in the decision-making process. The fifth step in making a good quality decision is where you're taking a criteria and saying, let's take what we're going to make a decision about and let's balance it on the criteria to make sure that we're covering all of our bases. And this will ensure safety of your loved one. Is safety a part of what's being considered? And do we have the resources that are needed to do the decision we're looking at? And then, do we understand the timetable? Is it realistic? And do we understand the negative impacts? Because every decision has a positive and negative. Well, identify what the negative outcomes might be so that you can weight the factor of, is this a good decision? And then, would you do this if, would you ask others to do this if they were doing it for you? Meaning it was done for you or to you. Is this still a good decision? These are all areas that you want to take a look at. The third coping skill is in the area of the family plan of action. And everybody could say, well, Roy, listen, we're just going to go out and do it. Well, it's going to get done a lot more effectively. I want to warn you that the addiction industry is not organized. And then again, either is the family. So you're taking two disorganized organizations and you're putting them together. So a plan is a very good idea. The other factor is you're going to more than likely require the assistance of a lot of different groups. And as time goes by, those groups are going to change. And now it's a whole new set of groups that you're dealing with. When you're at the hospital, the ER, that's what that is. Then you move over to detox, that's what that is. Then you move over to therapy and treatment, and that lasts for 16 weeks. That's what that is. Then you're looking at sober living, recovery, maybe incarceration, and then reentry. On all that's involved in that. So there's all sorts of reasons why a plan put on paper based on the decision and the information gathering that you've made, based on the solution that you know you want to use, are very good ideas. It all comes together with the plan of action. Then you take the plan of action and you go find a professional to help you. Everything that we've done up to now is to position you to a place where you can be properly assisted and directed and supported. This is what's often missing in the families. This is what exhausts the families. This is where the families get into fights internally on. So, for that reason, we're going to apply the 3D coping skills. Determine a solution. We're going to develop a decision, and we're going to design a plan of action. And we're going to do it each time. I hope this is helpful for you. I'm confident it will be.